I'm gonna knock on the door and introduce myself, wash my hand, and I will wear gloves if there is any open lesion. I will explain. Then I will explain the procedure to the patient and if they have any question. So hi. I'm Sabrina Jamal. I'm your nursing student today. So today we are going to do a health assessment on you. Determine the client's level of consciousness. Level of consciousness if the client is alert and oriented about to the person, place, time, and situation. So I'm gonna ask him his name. What is your name?
Arshan Zaman.
So where are you at now?
School.
School, okay. What is the time? What is the time?
It's 1:12.
Okay. And what is why you are here today? Do you know why you are here today?
To learn.
To learn? Okay. Okay. So then I'm going to ask the patient if they want to empty their bladder before I begin. Do you want to empty your bladder before I begin? You are okay to go through the whole health assessment? You're okay, right? Okay. So tell the patient to know if they experience. So I'm gonna ask you, like, if you feel any discomfortness or any pain, just let me know at any time during the whole assessment. Okay? Okay. So then I will position the patient 30 to 45 degrees angle. Then I'm gonna inspect and palpate skin for color, moisture, dryness, temperature, and lesions throughout the exam. So inspect and palpate. Then I'm gonna inspect. I'm gonna wash your hand. I have washed clean hands, so I'm gonna I'm gonna check for symmetry, color, discomfort. Are you okay?
It's a goal.
Okay. So I'm gonna check for the hair color and the distribution and texture. Then I'm gonna inspect and palpate the skull for size and symmetry, shape. Inspect the face for full skull size. Inspect the face for size, shape, and symmetry. And then inspect then I'm gonna inspect the frontal and the maxillary sinuses. For swelling and tenderness, any lesions or masses, I'm gonna document it. Inspect the eyelids, then lower conjunctivas, sclera, iris, and pupils. Note any lesion and drainage. Assess eyes for perla, which is pupils. Pupils are regular, radiant, and regular reactive to the light and accommodation. So I'm gonna check her eyes. If he wears a corrected lens, test vision with the Snellen chart. So eyes, assess eyes for ocular movement, 6 cardinal fields of gaze. So look at this and just follow my direction, okay? Okay, and then I'm gonna check for inspect the nose for size, shape, noting any lesion, messes, and drainage. So I'm going to check her your nose, okay? So I'm going to check like for the nasal patency. The way I will check, I will close one of your nostril and you have to deep breath, like take a deep breath. This one. Okay. And then inspect the ears for size, shape, and symmetry. Note any lesion, masses, or drainage. So I'm gonna assess how you hear. So do you hear me real well? And if I whisper, I'm gonna whisper in your ear. So you're gonna tell me what is that, okay? What I said.
You said Arshan.
Okay. So inspect the mouth and tongue for color, position, movement, speech, moisture, and condition of teeth. Can I see your mouth? Okay. I'm gonna check with a stick. Check the. I will check her his any lesion, the color, lesion, position, movement, speech, moisture, and observe condition of teeth. So can I see your teeth? Yeah. Okay. So palpate bilaterally temporal pulse. Now I'm gonna check for temporal pulse. Okay, I'm gonna check it. I'm gonna count for 60 seconds. I'm gonna document that number, rhythm. Okay, and then I'm gonna inspect and palpate facial and neck lymph node and note any swelling or masses. So I can see that he has a little bit of swollen lymph node because he got a cold. So I can see, I can actually palpate that. Okay. Okay. So palpate literally carotid, bilaterally carotid pulse. Palpate bilaterally carotid pulse, one at a time. So I'm going to palpate your carotid pulse here. And then I'm gonna note the strength and the rhythm. Then patient ability to perform active range of motion. Arshan, Mr. Arshan, can you look side by side, move your neck side by side? Okay. Can you wait a minute. Okay. And then I'm gonna check shrug shoulders. Just do it like that way. Shrug shoulders. And then inspect for jugular vein distension. So in order to do that, patient need to lay down on the bed like 30 to 45 degree angle so that I can check the jugular vein distension. Inspect fingernails bilaterally, noting that any texture, noting color, texture, clubbing, and capillary fills. capillary refill. So I'm gonna press it and then press on the finger and check how fast it gets its blood come back to its original position. Like, okay. And then as a skin target back of the hand or sternum, like that, it came back to the normal. And also in the sternum, it came back to the normal. It means that he's not dehydrated. So palpate bilaterally brachial and radial pulse. I'm gonna check brachial. I'm gonna check brachial and then radial pulse. Brachial, and then I'm gonna check radial pulse. I'm gonna count and document the number of the rhythm, and I'll count it for 60 seconds. Okay. And then I'm gonna test muscle strength in upper extremities. So I'm gonna check your muscle strength, okay? So I'm gonna pull your arm, but you pull this arm to yourself, okay? To you, and I will pull it against you. So that's how we will actually test your muscle strength. Okay. So then inspect and palpate. Inspect and palpate joints in upper extremities. Appear edematous. If there any edema or any tenderness, if I notice, then I will document that. And any swelling, limitation of movement, I'm gonna ask him if do you have any pain while I'm moving it. You don't have any pain, right? So inspect and palpate the pericardium areas. Now I'm gonna check your heart. Listen to your heart real quick, okay, Mr. Arshan? Okay. So I will go first. I will inspect and palpate the pericardium area, that is pulmonate pericardium area, and then I will inspect and palpate like that. I will check for size, symmetry, and color, and then I'll auscultate heart sounds in 5 anatomical areas. And I will listen for S1 and S2 sounds. So, and then I will assess apical heart rate for 60 seconds. Okay, now so now I will inspect anterior and lateral posterior chest wall for size and shape. So can you come this way so that you can show in the video? Yeah, I will auscultate I will inspect an anterior and lateral posterior chest wall like that. Can you stand up so that I can show them to you? Like that. I will palpate and inspect any irregularity I will check for color, shape, and symmetry. And posterior, I will do posterior wall. I'm gonna check like that way. Okay. And then auscultate anterior. Then and lateral, I'm gonna, can you lift your arm like that? And then I'm gonna lift your arm like that. Okay.
Oh, you're gonna
Laterally.
Can I see?
Laterally.
See what?
Laterally. Okay. And then I'm gonna check, palpate an anterior posterior chest. So auscultate anterior lateral on chest wall. I will gonna listen to your lung from anterior and the posterior. Now you can you take a deep breath for me?
What is that? I don't know what's that.
So this is where my health assessment ends at lung assessment. So it will be end at my lung assessment. So this is today I inspect and I assessed his health from head to toe, and for any unusualness, and also I ausculted his lungs, his heart, and yeah, and I think this is it for today's class. Thank you so much.
And also, I have to do 1 second.
Okay.
Yeah!